Hello, everybody. We're welcoming here today Mr. Sean Casey, the Health Emergency Officer for the World Health Organization. He will be briefing you after he came back from Gaza. The floor is yours. Please go ahead.
Thank you. Good afternoon, colleagues. I just returned from 5 weeks in Gaza with the World Health Organization. I deployed on December 4th and was there for just over 5 weeks as the emergency medical team coordinator, based in Rafah, but working across the Gaza Strip. I visited Al-Shifa Hospital 3 times. I think I visited 6 of the 16 hospitals that remain functioning today across the Gaza Strip out of 36 that were previously functioning. Every time I went to the hospitals, I saw evidence again and again of the simultaneous humanitarian catastrophe that's unfolding. We see it every day in Gaza, getting worse and worse, and the collapse of the health system day by day, with hospitals closing, health workers fleeing, casualties continuing to stream in, lack of access to medicines and medical supplies, a lack of access to fuel to run hospital generators, to keep the lights on, to keep the machines running. And it's happening alongside a dramatic humanitarian catastrophe just in the communities. So every day I'd see truckloads and busloads and van loads of people fleeing to the south with all of their belongings, setting up new shelters, plastic sheeting, and a couple of pieces of wood on the street, now becoming their new home with all of their belongings. From the WHO side, we have been and continue to try to deliver critical medicines, medical consumables, fuel to the functioning hospitals that are still working, trying to continue to surge in additional health workers, doctors and nurses, to meet the enormous demand of trauma patients, but also patients with every other clinical presentation that you would normally see. The pregnant women who still need antenatal care and who still need to deliver, the people who require dialysis, et cetera. And facing many challenges in doing so. Access constraints, security constraints, limitations on our movements. I was able to reach Al-Shifa Hospital 3 times, but we went a period of 12 days during which time we could not deliver food, medicines, fuel, any supplies to what was the largest and most important health facility in the Gaza Strip, a 700-plus bed hospital. And what I saw in Al-Shifa, I'll tell you in particular, was a hospital that was brought down to becoming a trauma stabilization point. Basically, the whole hospital was filled with displaced persons, thousands of them, reportedly tens of thousands of them, living in the operating theaters, living in the corridors, living in the stairs. And the emergency department, seeing hundreds of patients a day, mostly trauma, with only a handful, literally 5 or 6 doctors or nurses to care for all of those people. Patients on the floor, so many that you could barely move without stepping on somebody's hands or feet. In Al-Ahli Hospital, also in the north, I saw patients who were lying on church pews, basically waiting to die, in a hospital that had no fuel, no power, no water, very little in the way of medical supplies, and only a handful of staff remaining to take care of them. Further south, in Khan Yunis, last week, I visited Nasser Medical Complex, where they had only 30% of their staff remaining and about 200% of their bed capacity. So patients everywhere, in the corridors, on the floor. I went to the burn unit where there was 1 physician caring for 100 burn patients. So a really horrifying situation in the hospitals. Challenges every single day to get convoys with critical fuel, critical supplies to these hospitals so that they can continue to provide some level of care and comfort to the people who are suffering really enormously. And at the same time, part of my individual focus was mobilizing emergency medical teams. So getting additional surgeons, additional doctors, nurses into the hospitals to try to save life and limb, to avoid unnecessary amputations, to treat the many children that I saw with terrible shrapnel injuries and gunshot wounds, and to establish field hospitals. Rafah is now hosting almost 1 million people. A few weeks back, it was 270,000. So it doesn't have the healthcare infrastructure to deal with this huge influx of internally displaced persons. It doesn't have the physical space, even now, to host these people. They're on the sidewalks, on the street. So we're working on mobilizing additional field hospitals, additional healthcare workers, to backfill some of the people who have been displaced, the health workers who themselves are fleeing for their lives, and to meet the significantly increased burden of care that is created by injuries related to the hostilities and related to the living conditions, the atrocious living conditions that people are in now, sleeping under tents with no access to water, no access to food, no access to basically the basics of life, a bed, something warm to sleep under, most of their possessions lost. And as a consequence, exposed to infectious diseases. So, just to summarize what we've seen, what I've seen personally, is a rapid deterioration of the health system alongside a rapidly increasing level of humanitarian need and diminishing level of humanitarian access, particularly to areas north of Rafah. Every movement throughout the Gaza Strip requires coordination. Every movement presents risks and logistical challenges. We tried every single day to overcome those challenges, to be able to provide some level of care and comfort for the many thousands, 50, 60 plus thousand people who are injured, who are still awaiting care, thousands of surgical cases that are still awaiting care, and a health system that's really on its knees and unable to meet the huge number of men, women, children, elderly who are presenting to the hospitals every day, seeking some comfort.
Thank you, Sean, for this. We're going to go to the room. Yes, Edie, of course.
Thank you very much on behalf of the United Nations Correspondents Association for doing this briefing. My name is Edith Lederer from the Associated Press. You painted a really grim picture of what's going on. Did you get to talk to any Israeli officials at all, either during or after your time there? And if you did, what would you tell them are the greatest needs and what they could do to try and overcome these obstacles?
Thanks, Edie, for your question. I didn't talk to Israeli officials. My focus was on Gaza and the health system in Gaza, trying to get services to hospitals and health facilities and care for patients. I talked a lot to health workers across Gaza and patients in Gaza, people who were, with severe injuries. Let me just say it as I saw it. I saw patients in hospitals every day with severe burns, with open fractures, waiting hours or days for care, and they would often ask me for food or water. It demonstrates the level of desperation that we see. So in addition to their injuries and illnesses, they're just crying out for the basics of life. What could change those dynamics? Access is an enormous one. The ability to move people and supplies safely and quickly. We're talking about life-saving skills and life-saving supplies. Overall, the most critical need is really a ceasefire, because everything short of that is simply addressing needs on a day-by-day basis. So every day we're trying to play catch-up with the 60,000 injuries and the 200 plus new injuries that are occurring every day in a health system that is quickly losing its capacity. So what I would ask for of anybody who has any ability to change this dynamic is, one, a cessation of hostilities so that the injuries can stop and that the aid can reach the people who need it the most. But short of that, improving access, simplifying access. The last week that I was in Gaza, we tried every single day for 7 days to deliver fuel and supplies to the north, to Gaza City. And every day, those requests for coordinated movements were denied. That prevents us from bringing medicines to people who need it, to bringing water for dialysis machines to people who are sitting there waiting for care that can be provided. So access and safety are the most important.
Just a quick follow-up. Were you given any reason for the denial of access by the Israelis? And could you also address the difficulty of getting medical staff into Gaza?
So the reasons for lack of access were generally security or operational reasons in general terms. We would plan every day, submit a request, the request would be denied, and we would submit it again. Essentially the same plan with the same destination and the same supplies. So that happened 6-7 times. And for 12 days, we were unable to reach the north. So partially it's related to security, and sometimes we could see that firsthand. We could see that there were hostilities happening on the road that we would need to take. Other times, it was less obvious. Sorry, your second question related to medical supplies?
Medical staff.
No,
Staff.
to the medical staff of getting you, because it seems from what you said that there's a real shortage of medical staff.
It's interesting, actually. There's not really a shortage of medical staff in overall terms. Gaza has a historically strong health system, 36 hospitals, 25,000 health workers, many specialists. They're all displaced. 85% of the population of Gaza is displaced, and that includes the health workers, the surgeons, the nurses, the doctors. Hospital directors were telling me how their surgeons, plastic surgeon, for example, could not do surgery because he was out collecting sticks to burn as firewood to cook food for his family. And so when health workers are not able to get to work, patients don't get access to care. What we were trying to do was mobilize international responders, emergency medical teams, to support hospitals, to provide care within the hospitals, and sometimes, when that's not possible, to establish field hospitals. There are several field hospitals that have been established, mostly over the last 6 weeks or so, in Rafah. And the challenge of getting those teams to the hospitals mostly relates to security. Areas around the hospitals have been evacuated. Leaflets have fallen saying you need to leave this area within the next 24 hours. There are hospitals that have been directly hit by fire, by small arms fire or larger munitions. And in several cases, those teams, one of them, Doctors Without Borders, MSF, announced that they left Al-Aqsa Hospital just over a week ago because of insecurity in the area and evacuation orders. And so when health workers can't be safe, they can't operate. And even the local healthcare workers who haven't fled south to Rafah said to me several times that they're living in the hospital because they can't move safely between their home and the hospital across the road because they're worried that they might be killed along the way. So without safety, health workers can't get to where they need to be.
Maggie, go ahead.
Hi, Mr. Casey. Thanks for doing this. My name is Margaret Bashir with Voice of America. I just wanted to ask you on the medical supplies that are what's being rejected by the Israeli authorities. Is it specific items? Does it change day to day what they allow in, what they don't allow in? And do you have any evidence of any of your supplies being stolen by Hamas?
So actually the main challenge is not medical supplies being rejected per se, it's being able to get those supplies to the last mile. So there is a limitation on the number of trucks that get across the Rafah crossing on a daily basis. That includes food, medical supplies, shelter supplies, and everything else. There are not enough trucks getting across. Prior to this conflict, there were 800 or so, I believe, trucks that would cross Rafah every day, almost all commercial. Now we're in much lower figures than that on a daily basis with significantly increased needs. The main challenge is getting those supplies once they're in to the health facilities, and having health workers there to use them. I mean, we've seen so many hospitals that have actually struggled to have enough staff to even unload, when we are able to get medical supplies in, unload the kits and get the supplies to the wards and have health workers there who can use them. So supply is part of the problem, but it's really the overall package. If you don't have health workers, you don't have a safe health facility, you don't have supplies at that facility, you don't have fuel to run the generators, then you can't do the surgeries, you can't provide the post-operative care. So it's not as much about things getting across, that's part of the story, but it's the whole package. Without having that whole package of care, including the people, the supplies, the place to provide services, and all the peripheral support services, that care can't be provided. And there's I have no evidence of supplies that have been delivered to hospitals going anywhere except to those hospitals. I've seen them used immediately. I've seen the boxes opened so that specific drugs can be accessed. But no, I don't have any evidence of supplies going anywhere else.
And just, there were reports a few weeks back that the French were sending a hospital ship. Did it ever arrive? And is it actually possible to get injured Palestinians to it? You know, logistically, is it possible? And are the evacuations still going on through Rafah? They were, in the beginning, they were taking some people out in the end of November, I think, during the pause, but have severely injured people still been going through Rafah to Egypt for treatment?
So medical evacuations are not my primary area of expertise, but what I can say is that the numbers of medical evacuations going outside of the Gaza Strip is very limited. So we know that there are thousands of people who would benefit from higher level care that can no longer be provided within the Gaza Strip. It's not possible to provide that care. That includes oncology care, care for some of the complex trauma cases, et cetera. That's related to approvals on a number of sides to get out of Gaza, to get into Egypt, and then to get to either one of those ships. Those ships are in Egypt, actually. They're anchored in Egyptian waters, but it's not only that. There are hospital beds in Egypt. There are hospital beds in a number of other countries that are willing to receive these patients. It's a matter of primarily getting approvals from various parties to get them out. No patients are getting to those ships, but the number of patients that are getting out of the Gaza Strip is nowhere near the level of need.
Okay, let's take a question here, and then Sharifa, and then Linda. Yes, go ahead.
Hi, Mr. Casey. My name is Gabriel Elizondo from Al Jazeera English. Thank you for your informative briefing. The Ministry of Health in Gaza reporting today that hepatitis A is spreading very fast. Can you confirm that by when you were there, and what are the ramifications of this? And then I have a follow-up.
Thanks, Gabriel. No, I can't confirm it. What I can say is that we've seen significant increases in jaundice, which is a potential indicator of hepatitis, of upper respiratory infections, of diarrhea, which is frankly unsurprising given the lack of access to safe water and sanitation facilities. These are the kinds of diseases or syndromes that you see spread when people are living in close quarters and cramped conditions without access to water and sanitation. We have brought testing kits in for hepatitis, and investigations are still underway to confirm what pathogens are actually being transmitted.
Thanks. Just a quick follow-up. Thanks for that. Two things. You're calling for a ceasefire. Can you just give us an idea, since you've been there, if a ceasefire was to be implemented on a Monday, let's say, how quickly could that save lives, and how quickly would a ceasefire allow you to be, and your colleagues to be able to do what you need to do to save lives? Will it still be a lag time from ceasefire to actually being able to help, or will it be almost immediate? And then follow up, you said you waited 12 days in one instance. What are the ramifications of waiting those 12 days for patients?
So a ceasefire would save lives instantly, because people would have access to hospitals that they don't currently have access to. They would have access to, they would be able to move. Right now, people are unable to move to health facilities that are partially functioning or minimally functioning, where they could get access to care. But a longer ceasefire would allow us to move supplies, would allow health workers to return to their duty stations, to their hospitals, would allow a much wider spectrum of care to be provided. Many of these specialists, as I said, and nurses are in shelters, under tarps, under plastic sheeting in Rafah, and not in their hospitals. So having a ceasefire would provide immediate benefit to the people of Gaza because they would be able to access care, but it would also allow us, our UN partner agencies, World Food Program and others, to move food. It would allow us to move medical supplies. It would allow us to provide fuel to hospitals. Hospitals are not very functional if they don't have power. And all of the hospitals in Gaza rely on fuel for generators. So it would allow us, we have the fuel, we have the trucks generally on standby. When I talked about those 12 days that we didn't deliver to the north, we had trucks lined up every single day, ready to go. So those trucks are ready to go, from WHO with medical supplies, from WFP with food supplies, with all kinds of supplies and equipment for the population, shelter kits, et cetera, and they're not able to move. So that we would see a benefit within 1 day, 2 days in terms of movement of supplies. A longer-term ceasefire would allow for services, basic services, life-saving services, to resume function. I mean, we have water treatment facilities that are not working. We have sewage systems that are not working. That takes time to recover. So I think, a short-term ceasefire is not going to allow that kind of recovery to happen, and that's what's needed when you have 1 million people putting a huge amount of pressure on a system that was built for 270,000.
And the ramifications of the weight on patients?
The ramifications is that people are dying every day. It's very simple. I mean, I've seen children full of shrapnel dying on the floor because there are not the supplies in the emergency department and the healthcare workers in the emergency department to care for them. The ramifications are very simple. People are 20,000 plus deaths, 60,000 plus injuries, and new injuries and deaths every day, hundreds. So every day that doesn't happen, there are more injuries, and the backlog of people who need care continues to grow and grow.
Sharifa, please go ahead.
Thank you, Sharifa from Anadolu. According to WHO statistics, it's only 15 out of Gaza's 36 hospitals that are partially functioning, and Israel targets the hospitals with the claim that they're used by Hamas as headquarters. In your visits to these hospitals, have you seen any evidence supporting such claims? And do you believe that the direct targeting of hospitals would constitute war crimes? Thank you.
So I'm not a war crimes expert. I'm not a lawyer. But what I do know is that under international humanitarian law, health facilities and health workers and patients must be protected. And at the moment, we see patients and health workers fleeing hospitals. When I was at Shifa, what I saw actually was patients seeking shelter in hospitals because in Gaza City, it's one of the few places that's perceived to be safe, where they hoped that they would have some level of safety. So there were tens of thousands of people, to the point where I couldn't even get into the operating theater. We were trying to visit an operating theater to see how we could get it functioning again, and it's filled with displaced people, so we couldn't even get into it. But no, I didn't. My focus when I go to hospitals is talking to health workers and talking to patients and understanding the needs. I haven't seen any evidence of hospitals being used for anything other than being a hospital. I also haven't been looking for that. That's not my role. My role is to, and WHO's role is to provide healthcare services, make sure that hospitals are able to provide healthcare services for the population, and that healthcare workers are able to do their jobs.
Thank you so much.
Linda.
Thank you, Linda Fasulo, representing NPR. My question has to do with commercial deliveries. I mean, I don't really quite understand that. I gather there are humanitarian trucks coming into Gaza, and you work with them. What role do the commercial trucks and groups play in working with you?
So the commercial side is critical. It's critical to life everywhere. We all go to the shops to buy our food. We rely on the private sector to meet many of our basic needs. In Gaza, that's pretty much stopped. In Rafah, there's some commercial activity that's restarted. There are some trucks coming across from Egypt with food. Unfortunately, a lot of it is on the market but inaccessible. So I see every day I was in Gaza, in the last couple of weeks, I would see tomatoes, eggplant, broccoli, cauliflower for sale on the market, but very few people buying it because they couldn't afford it. We've seen some flour come across, and in Rafah you could feel the temperature kind of coming down from the food insecurity. So people have a little bit of sense that they'll be able to eat for the next few days. You don't feel that going farther north, where every time I would walk into Shifa or Al Athli, and I'd see patients literally dying, and they're asking for food, and their families asking for food, and they'd see our trucks coming and rush towards them, hoping that it's food, and actually climbing on the trucks, and we would have to say over our loudspeakers as we drive across Gaza, this is medicine and medical supplies for a specific hospital, and people would actually clear the debris out of the way. They would help to open the road so that we could get through. But the commercial activity is essential to help people access food if they can afford it. The more commercial activity, the lower the prices will be. The prices are incredibly inflated right now, and people will be able to access their basic needs.
But about what portion of the food supply, for example, is provided commercially versus?
I wouldn't know. I mean, I'm not an expert on food supply, but in Rafah, there's some commercial activity happening. In Khan Yunis, there was a little bit. As you go further north, you see less and less. But I wouldn't know the exact percentage, unfortunately. But not very much. And in the farther north you go, the less you see.
Let's go to the screen first, and then we'll come back to the room. Abdelhamid, you had a question. We can't hear Abdelhamid. Abdelhamid, 1 second. Okay, can you please talk?
I'm sorry, you can hear me now?
We can hear
Can
you
you hear me?
perfectly. Yes, go ahead.
Okay, thank you so much. Thank you, Mr. Casey. This is Abdelhamid Sayam from the Arabic daily Al-Quds Al-Arabi. Sir, I want to commend you for your courage and your ironclad nerves to see these atrocities right before your eyes. I have a few questions. First, we have heard how many UN staff killed from UNRWA. We haven't heard if WHO lost any staff. And if you have any number of Palestinian doctors, nurses, health workers who were killed in this genocidal war. And the second, I always try to follow the briefing of every UN official, and they talk about the symptoms, the crime, but not the criminal. The criminal is always missing. These are not these are man-made crimes. Somebody committed these crimes. It's not nature. It's not an earthquake. It is a man-made crime. Who did it?
Abdelhamid, just for the sake of time, because I'm sure he has other things to do after. Just
That's
ask
my
the
two
question.
questions.
Yeah, ask these questions and let's go. Thank you.
Who did these crimes? Who is the doer? Who is the accomplice? And about the number of people killed from WHO and health workers. Thank you.
John.
Thanks, Abdelhamid. Thanks for your comments as well. My colleague Dima was killed in November. She worked at the limb reconstruction unit I believe in Nasser Hospital. And we've lost over 140 UN colleagues mostly from UNRWA. While I was in Gaza, several of my colleagues lost members of their families. Their houses have been destroyed. We haven't had the same level of mortality that UNRWA has had. UNRWA has 13,000 staff in Gaza. And many of those people, unfortunately, were killed in their homes or lost their lives in their homes or in the street. So I don't know if we can say that we've been fortunate. I mean, I did have a colleague who was killed. But we don't have the same scale of staffing in Gaza that some of our partner UN agencies have. And in terms of the number of health workers killed. Unfortunately, I don't have that number. We've had, even just the last few days, there's been another communications blackout. One of the things that we've discussed many times is that we'd prefer to not have to bring in international physicians and nurses when there's 25,000 plus doctors and nurses in Gaza. The reason that we have to do that is, one, that the health workers who are from Gaza have been displaced and themselves are suffering and trying to survive. And two, because we have very little way to communicate with them. So they have no internet, they have no cellular service, they have almost no means of communication. So if we had a way to communicate with them, if we had internet and phone service, the health authorities, the hospitals themselves, the administrators, could contact those health workers, and if there could be a way to accommodate them and their families safely, close to hospitals, they would return to work, I have no doubt. But in terms of the number killed or injured, I don't have that, unfortunately. But what I do know is that there are unbelievably brave health workers across Gaza who are staying and taking care of people because there's nobody else to do it, and that many more would return to work if they had a safe way to do so, and if they had a place to live and care for their families.
Tony, you had a question.
Yes, thank you. Thank you, Sean, for your briefing. Tony Naddaf, Al Hurra TV. You mentioned access constraints, but the question is there enough medical supply and health supplies with the WHO that you, or maybe you need some more to be delivered? Is the problem only the access constraints?
There's not enough. I mean, it's again, I'll go back to the whole package answer, where we do need more medical supplies. If you look at the overall needs, the number of injuries, we absolutely, and the number of illnesses, we absolutely need more medical supplies and medicines. We also need providers to deliver them and to prescribe them, and we need a health facility that patients can go to access them. So we do need more, and at the same time, we need more doctors and nurses who are working. We need more health facilities to be operational. When only 15 or 16 of the hospitals are functioning, that's only even part of the story. Many of them are minimally functioning. Al-Shifa was a 700 plus bed hospital. It's now an emergency room that's full of severely injured patients and 5 or 6 doctors or nurses. So optimally, that hospital would be full of medical supplies, but also full of staff who can use the medical supplies to care for the patients. It's never just about the supply. It's about the full range of services that need to be provided, and the people that you need to provide those services, and the safety that is needed for the patients and the health workers to get there.
Just a quick follow-up, if I may.
Sure.
Also, like a few weeks ago, the word around was that the health system in Gaza is nearing a complete collapse. Are we still there?
So there were 36 hospitals in Gaza a couple of months ago. Today there are 15 or 16 that are partially, it changes by the day, actually, that are minimally or partially functioning. There is absolutely not the capacity to meet the need. And health facilities have closed. I've seen it happen, where one day they're working, and 2 or 3 days later, they're not working at all. Because the health workers have been forced to flee, because people don't feel safe, because there are hostilities in that area. So the health, I've said it, I've seen the health system collapsing before my eyes, where you see hospitals that, Nasser Medical Complex, the first time I went there, it was at 200 or so % bed capacity, but most of its health workforce there. When I was last at Nasser Medical Complex just over a week ago, they had 30% of their health workforce there. And today I don't know what that number is, but I presume it's even less, because there are evacuation orders around that entire area. So it is collapsing. When key health facilities are no longer functioning, that is a health system in collapse.
So if there are no more questions in the room or on the screen, I would like to thank our guest from WHO, Mr. Sean Casey. Thank you for your patience, and thank you for being here.
Thank you.